Hi, I'm Dr. Gabriel Costa, a physician specialized in senior health and elderly care, and over the past 15 or so years, a great deal of my work has been dedicated to understanding what happens to our bodies as we age, not just in the clinic, but in the real, everyday choices we make. And today, I want to talk to you about something that genuinely worries me. This is a warning about a danger that is hiding in plain sight, and quite possibly, it is sitting right now in your own medicine cabinet. I have seen the devastating consequences time and again of medications that an enormous number of older adults are taking every single day, believing they are as harmless as a piece of candy. These are drugs people reach for when they have pain, heartburn, or a simple head cold. But the reality I see in my patients, and what the science is increasingly confirming, is that some of these medications, far from helping, may be silently weakening the most vital muscle we have, the heart. Now, I am not talking about obscure treatments or experimental drugs. I am talking about over-the-counter pain relievers, stomach protectors that millions of people take as part of their morning routine, and plain old decongestants. The scientific evidence combined with my own clinical experience paints a picture that we simply cannot ignore. Without realizing it, many people over 60 years of age are increasing their risk of serious cardiac events. My goal today is not to frighten you. It is exactly the opposite. It is to give you clarity. It is to give you the knowledge to protect yourself and take real ownership of your health and wellness. Because the true danger is not the disease itself, it is the lack of information about the risks we are quietly running. So let us walk through 5 common types of medication that carry genuine heart health risks for older adults. I will explain why each one is concerning, how it works in the body, and most importantly, what you can do about it. Stay with me because this information could genuinely save your life or the life of someone you love. Section 1. The hidden danger in pain relief, NSAIDs or non-steroidal anti-inflammatory drugs. Let us start with the most common group of medications found in any household, non-steroidal anti-inflammatory drugs, or NSAIDs. Names like ibuprofen, naproxen, and diclofenac will almost certainly ring a bell. These are our first instinct for a headache, a sore back, or the ache of arthritis. They work, there is no question about that, but using them without careful thought, especially if you're over 60 or already have a heart condition, is a bit like playing Russian roulette. The medical community has known for years that these seemingly harmless pills have a dark side. Back in 2005, the FDA required that clear warnings be added about the risk of heart attacks and strokes associated with NSAID use. Let me tell you about Robert, a 72-year-old patient of mine who loved gardening. He had osteoarthritis in his knees, and to manage the pain, he was taking diclofenac almost every day. One afternoon, while tending to his rose bushes, he felt completely exhausted, short of breath, and noticed his ankles had swollen to nearly twice their normal size. In the emergency room, we discovered he was experiencing acute heart failure. His heart, which was already working harder than it should due to his age and mild high blood pressure, had simply reached its limit. The trigger was not some new cardiac problem, it was the continuous use of that everyday anti-inflammatory. How can something so ordinary be so dangerous? The mechanism is subtle. NSAIDs block certain enzymes to reduce inflammation, but in doing so, they also interfere with substances that protect our kidneys and blood vessels. This produces 2 serious effects. First, they cause the body to retain salt and water. Think of your heart as a pump. If there is suddenly far more fluid in the pipes, the pump has to work at full capacity all the time. A young heart can handle that, but one that is already dealing with the stiffness that comes with age or fighting against high blood pressure can become overwhelmed, exactly as happened with Robert. Second, NSAIDs can constrict blood vessels and raise arterial pressure. Even if you are not hypertensive, regular use can push your blood pressure up, and if you are already on medication to control your pressure, NSAIDs can blunt its effect, causing your numbers to climb without you even knowing. Here is the key thing to understand. The risk depends heavily on dose and duration. Drugs like diclofenac and ibuprofen at high doses, 2,400 milligrams per day, are the ones most strongly associated with cardiac problems. Naproxen at lower doses appears somewhat safer, but the risk is never zero. And on top of that, if you are taking a low-dose aspirin to protect your heart, some NSAIDs like ibuprofen can actually cancel out that protective effect. So, what do? The answer is not to grit your teeth and endure the pain. The answer is to talk to your doctor. Ask directly, with my medical history, what is the safest option for managing my pain? There are real alternatives. Sometimes acetaminophen is sufficient. Topical anti-inflammatory creams or gels that work locally are often an excellent option. And if an NSAID truly is necessary, the golden rule is the lowest effective dose for the shortest possible time. Section 2. The false protector, proton pump inhibitors or PPIs. Now we come to number 4 on our list, and this one may surprise you because it is widely known as the stomach protector. I am talking about proton pump inhibitors, or PPIs. Omeprazole, pantoprazole, lansoprazole. These are among the best-selling drugs in the world. Millions of people take one every morning almost as a ritual for acid reflux or to shield the stomach from other medications, like the NSAIDs we just discussed. And here is the irony. The medication prescribed to protect you from one risk may be quietly creating another. Let me tell you about Eleanor, 68 years old, who was prescribed omeprazole for chronic acid reflux. She was told to take it long-term. Her heartburn disappeared and she never questioned it again. Years later, at a routine checkup, her electrocardiogram showed something unexpected. A blood test revealed the cause. Her magnesium levels were critically low. Magnesium is the guardian of heart rhythm. When it is deficient, the heart becomes electrically unstable, like an orchestra without a conductor, and dangerous arrhythmias can develop. The cause of Eleanor's deficiency? Long-term omeprazole use. PPIs reduce stomach acid, but that acidity is crucial for absorbing nutrients. When it is suppressed over a long period, magnesium absorption drops significantly, but the concern does not stop there. What worries us even more is this. Several observational studies have found an association between PPI use and an increased risk of heart attack. One leading theory is that these drugs may reduce levels of nitric oxide, a molecule that keeps our blood vessels flexible and healthy. When nitric oxide falls, vessels stiffen, setting the stage for cardiac events. The causal relationship is still being debated, but the association is significant enough that we take it seriously. There is also the issue of drug interactions. Omeprazole, for example, can interfere with clopidogrel, a blood thinner commonly prescribed after a heart attack, potentially making it less effective and leaving the patient more vulnerable. The deeper problem is that these medications have been trivialized. They were designed for short-term use, 4 to 8 weeks, but they have become a permanent solution for problems that, in many cases, could be addressed through lifestyle changes. If you have been taking a PPI for months or even years, please do not stop suddenly. Talk to your doctor. Ask, do I genuinely still need this long-term? Can we lower the dose? Are there alternatives? And if chronic use is truly necessary for your situation, it is important that your doctor monitor your magnesium levels on a regular basis. Before we continue to the next medications, which includes something as common as a cold remedy, I want to take a brief pause. If what you have heard so far feels useful and important, I have 2 simple requests. First, subscribe to this channel. My mission is to bring you clear, no-nonsense health information so you can make the best possible decisions for yourself and your loved ones. Second, and maybe more importantly, share this video. Think of your parents, your grandparents, your close friends. A single click could spark a conversation that genuinely saves a life. Thank you for your support. Now let us move on to number 3, something almost everyone has at home. Section 3, the danger in a common cold, oral decongestants. Number 3 on our list, oral decongestants for colds and congestion. The ones containing pseudoephedrine or phenylephrine. They are the go-to solution for that blocked nose that will not leave you alone. But that quick fix can come at a very high cost to your heart, particularly if you already have high blood pressure or any form of cardiac condition. Margaret, a retired school teacher of 75, caught a bad cold. To be able to breathe, she picked up a well-known cold and flu tablet at the pharmacy that contained pseudoephedrine. By the second day, she felt as though her heart was pounding out of her chest, along with dizziness and a severe headache. Her son took her to the hospital. Her blood pressure had shot up dangerously, and she was in arrhythmia. That decongestant had pushed her system to the breaking point. Why does this happen? Pseudoephedrine and phenylephrine are vasoconstrictors. Their job is to narrow blood vessels. In the nasal passages, that is helpful. It reduces swelling and lets you breathe. But the drug does not stay in the nose. It travels throughout the entire body, tightening blood vessels everywhere it goes. This has 2 consequences. First, when the arteries narrow, the heart has to pump against a much greater resistance, like trying to push water through a squeezed garden hose. Blood pressure spikes. This can trigger a dangerous hypertensive episode. Second, these drugs are stimulants. They speed up the heart rate and can cause it to beat irregularly. If your heart is already vulnerable in some way, this extra stimulation can destabilize it. Importantly, European regulatory agencies have recently refocused attention on pseudoephedrine due to its link with rare but serious conditions involving narrowing of the blood vessels in the brain, which only underscores just how powerful its systemic effects can be. The real danger with these drugs is that they are sold over the counter. People buy them without reading the fine print and without thinking about the risks. If you are over 60, and especially if you have high blood pressure or any cardiac history, avoid them. There are much safer alternatives: saline nasal sprays, humidifiers, and steroid nasal sprays that act locally without affecting the rest of the body. Do not let relief for a stuffy nose become a cardiac emergency. Section 4, the mind-heart connection, certain older antidepressants. We have reached number 2, and this is a sensitive but vital topic, mental health. I am talking about an older class of antidepressants that are still in use today, sometimes for depression and sometimes for chronic pain. These are tricyclic antidepressants with names like amitriptyline and imipramine. Depression in itself is a well-established risk factor for heart disease, which is why treating it effectively is so important for overall wellness and prevention. But how we treat it matters enormously, and these particular drugs can be genuinely dangerous for the heart of an older adult. Frank, 78 years old, was suffering from severe nerve pain in his feet due to diabetes. His doctor prescribed a low dose of amitriptyline. It helped with the pain, but he began to feel dizzy every time he stood up. One day he fainted and fractured his hip. The cause was the amitriptyline, which was producing a sharp drop in blood pressure when he moved from lying down or sitting to standing, what we call orthostatic hypotension. But that is not the only risk. These medications can also elevate the resting heart rate, placing a constant, unnecessary burden on an aging heart. And what is more concerning is that they can interfere with the heart's electrical conduction system, slowing down its impulses. This shows up on an electrocardiogram and significantly raises the risk of ventricular arrhythmias, potentially life-threatening irregularities that can lead to sudden cardiac death. For all of these reasons, tricyclic antidepressants are no longer the first-choice treatment for depression in older adults. Today, we have newer antidepressants with much better cardiovascular safety profiles. However, tricyclics are still sometimes prescribed for neuropathic pain, as in Frank's case. If you or someone close to you is taking one of these medications, it is essential to have an honest conversation with your doctor. Have safer alternatives been considered? Is blood pressure and heart rhythm being properly monitored? Mental health and physical health are deeply connected, and we must make sure the treatment for one is not quietly harming the other. Section 5, the unexpected risk of calcium supplements. And here we are at number 1. This may be the most debated point in today's conversation, but it is my duty to share the concern that exists within the scientific community because part of good prevention is staying informed. I am talking about calcium supplements. Yes, those tablets that millions of people take every day to protect their bones from osteoporosis. For decades, the message was simple and clear. Take calcium to keep your bones strong. But in recent years, a growing body of research has raised questions about the safety of these supplements for the heart. Let me tell you about Lucy, 70 years old. Concerned about osteoporosis, she decided on her own to start taking a high-dose calcium supplement. Years later, she suffered a heart attack. She had none of the classic risk factors. She did not smoke, her cholesterol was fine, and her blood pressure was under control. As her medical team investigated possible causes, they turned their attention to that daily supplement. The controversy is real, and the evidence is not yet definitive, but the hypothesis is one that we take seriously. Calcium that comes from food, dairy products, leafy greens, fortified foods does not appear to be a problem. It is absorbed gradually, and the body uses it efficiently. The concern seems to arise specifically with the large, concentrated doses found in supplements. When you swallow a calcium tablet, it creates an artificial spike of calcium in the bloodstream. The body cannot direct all of that calcium to the bones fast enough, and the excess has to go somewhere. The main concern is that it may be deposited in the walls of the arteries. This process, arterial calcification, stiffens the arteries and can contribute to the formation of the plaques that cause heart attacks. Some large studies have suggested that calcium supplements modestly increase the risk of heart attack, while others have not found this connection. The evidence is genuinely complex, and for people with a confirmed diagnosis of osteoporosis, the benefits may well outweigh the risks. But the lesson is clear: more is not always better. The safest strategy is to get your calcium from food whenever possible. If your doctor determines that a supplement is truly necessary for your bone health, this should never be a decision you make on your own. It is a medical decision that must carefully weigh your bone health against, and this is important, your cardiovascular risk. Today we have uncovered the hidden side of 5 very common types of medication: anti-inflammatory drugs, stomach protectors, decongestants, certain antidepressants, and calcium supplements. My main message is not one of panic, and it is absolutely not stop taking your medications. Doing that on your own could be genuinely dangerous. My message is one of empowerment. You now have valuable information that a great many people simply do not have. You know that the pill for your arthritis may be overloading your heart. You know that your stomach protector could be affecting your heart rhythm. You know that a simple cold remedy can carry real cardiac risk. You know that certain older antidepressants can compromise your heart's electrical system. And you know that a calcium supplement, even one taken with the best intentions, warrants a proper conversation with your doctor. Use this knowledge to become an active partner in your own health. The next time you see your doctor, go prepared. Bring a complete list of everything you take, including supplements and vitamins, and ask clear, direct questions. Doctor, I have read that this medication may carry risks for the heart. Is it still the best option for me? Are there safer alternatives? Should we be monitoring anything? My blood pressure, my magnesium levels, an ECG? Every treatment is a balance between benefits and risks, and that balance shifts as we age. Your heart has worked hard for decades. It deserves the most careful, thoughtful attention you can give it. Do not take any medication for granted, no matter how familiar or common it may seem. And now I want to ask you one last thing. Share your experience in the comments below. Did anything here surprise you? Your stories and your questions can help others who are going through the same thing. And always remember, talk to your doctor. That conversation is the single most important step you can take today to protect your heart for tomorrow. Take care of yourselves.